Currently, about 53% of men are diagnosed at stage 1 or 2, which is a long way off the NHS target of 75% by 2028. And in a learning module we have, Professor Mike Kirby says that early stage prostate cancer usually doesn't cause any symptoms at all, which puts men at risk of late diagnosis. And in another learning module we've got on the topic, Dr. Tilman Jacobi, who's a GP, says around 1/3 of new cases of prostate cancer diagnosed in the UK are in men aged 75 years and older.
The no symptoms thing is interesting because that does make me think, is it that they don't have any symptoms or they are just not reporting them?
Well, I think they're two separate issues, really, because early prostate cancer is actually often asymptomatic because the cancer typically starts developing away from the urethra. So it's not until the cancer's grown large enough to actually have an effect on those tissues or press on the urethra that you get the urinary symptoms that people know about. And this is important because I think that's not widely known among patients. But that's not to say that there aren't issues around underreporting of symptoms as well. And as you say, I think embarrassment is a big one. But the good news is that prostate cancer does now have a 5-year survival rate of over 95% when it's diagnosed at those earlier stages, so between stage 1 and stage 3. However, for the 1 in 5 people who are diagnosed with stage 4 prostate cancer, the 5-year survival is just 49%. And Professor Kirby also pointed out that men diagnosed at those later stages can suffer significant impairments in their quality of life. And of course, the cost for the NHS treatment and investigation is much higher than if they were caught at an earlier stage. He also shines a light on the health inequalities that we touched on earlier, which is that Black men and those living in poverty are at a much greater risk of late diagnosis. And indeed, Prostate Cancer UK are strongly recommending that Black men visit their GP for a regular PSA blood test from the age of 45 years.